Hello, it's Dr. Darnise, and I'm on here today to talk about women's health. This is still Women's History Month. This is March 2024. And I'm here to talk about women's health, in particular black women's health, but more generally, women's health. The news just came out that Princess Kate has cancer. And the world has almost been making fun of the fact that people didn't know where Princess Kate was, right? Princess Catherine of Wales. And she'd been missing from her royal duties in England for some time. And then today's news is that she has cancer and she's been undergoing treatment. Now we know that she, because of her status, is going to get the best care that money can buy, right? She's royalty, so she's literally going to have the best medical treatment in the world. And it makes me think, though, of those women who don't, and how it is commonplace for the medical establishment to not take the concerns of women seriously, and especially black women. And so, I specialize in coaching black women, right, helping black women thrive. And so one of the ways in which we have to do that, we have to advocate for our own health. Now we know, there's all kind of legislation continuing to happen about women's health and women's choice over our own bodies. And that's really a strange thing that in the 21st century, women still have to almost beg for agency over our own bodies and simultaneously to continue to be disregarded in medicine. And so I've had my own experiences with this. My own mother passed away from a routine hysterectomy in 1988. And I'm sure that, I know, I know that her concerns following that surgery were not heard. She was just dismissed. Her pain was not taken seriously. And we know that this is the case. This is commonly the case for black women going to the doctor, that we are disregarded. Our pain is minimized because we're thought to literally have thicker skin and to be able to have higher pain threshold. So we don't need as much medication. Like, this has literally been what doctors have been teaching each other over the years. So when people go to medical school, they're literally told that for whatever reason, black women don't need as much pain medication. Now listen to how just thoroughly racist that is. You can't even call that anything else. And so, there are some who might see this video or might see anybody else's commentary or videos about, why it is that black women talk specifically about black women, or why we talk about race. And this is why. We see black women going to doctors and getting dismissed. We see women in general going to doctors and being dismissed. So in addition to Princess Kate coming out with her diagnosis, we also saw the recent death of a very influential YouTuber. Her name is Jessica Pettway. I want to make sure I got her last name correct. Jessica Pettway, right? She was a beauty influencer on the internet. And she was only in her 30s, and she just died from cervical cancer. And so her story is all over the internet. If you have not seen her story, just Google Jessica Pettway. And you'll see, like, she had been going to the doctor with her own, excessive bleeding. And over and over and over, she was told that it was nothing but a fibroid and that she didn't have to be concerned about it, despite the fact that she was, pretty much hemorrhaging, right? Passing out. Her husband would take her, scoop her off the bathroom floor, take her to the hospital. And it wasn't until after many, many times, many, many trips to the doctor in the hospital, that someone actually took a look. And actually, I guess they biopsied her vaginal lining, and her cervix, and they could then determine that she had, by then, late stage cervical cancer. And so the word goes out, along around the internet, and people are like, "Oh my God, what a sad story! This beautiful young woman." It's such a common story, and so black women keep raising the flag. Hey, my blues ain't like yours, right? Our bodies are not the same, and why is it that we have to continually petition doctors and the whole medical establishment to acknowledge our pain or our um, medical concerns? Why do we have to go through this? Well, it's another aspect of systematic racism. And for those who don't like to talk about systematic racism, this is why we do it, because there is built into systems a way that disregards people of color, and it just gets bumped down to the next person, to the next person, to the next person, and that's the cycle continues. And so you can have somebody like Henrietta Lacks, right, where they used her cells. Probably you've heard about her, read the book, or saw the movie about the immortal life of Henrietta Lacks, played by Oprah Winfrey. Doctors took cells from her body without her knowing and without her permission, because remarkably the cells in her body kept reproducing, right, in ways that are extraordinary and that don't happen in most people and anybody else. So the story was written, and the movie was made because it's the story of the family now going back and saying, hey, you have been, because they're continuing to use her cells. The medical establishment continues to use her cells out of Johns Hopkins. Anyway, I'm going too far down that rabbit hole. What I wanted to do is say focus on why it is that black women need to, in order for us to really thrive, and I'm always talking about, we have to advocate for ourselves. We have to go to doctors' offices and be very vocal and be very loud, such that we're able, right? If you are in a situation where you're not even able to speak for yourself, that's one thing. But, I just went to a series of medical treatments myself. Well, not even treatments, thankfully we didn't get to that point, but medical examinations over and over. And I relocated, some of you know, I relocated from Los Angeles to Savannah, Georgia. And in doing so was a hellacious time, just getting my records, And then having to go back to the doctor repeatedly. There was complications with my insurance paperwork. There's this. And I was like, but in the meantime, I still need to see somebody. Oh, okay. It was really nightmarish for, like, I'm going to say 7 months. And when I finally did see a doctor, when I finally got in the system, it started to work for me, right? I came across very good medical care and very kind people along the way, I'm happy to say. But it took a lot for me to get there, and I shouldn't have had to jump through all of those hoops. And by the time I went and had a GYN appointment, a gynecological, had a white male doctor. And, what I was grateful for is that he talked to me about things that affect black women in certain ways. That let me know that he was a doctor who cared, who saw me in my totality, who stayed up on research. Now, he appeared to be a man like maybe about 60, late 50s into early 60s. And so he takes his medical practice seriously. He looked at me and said, right, no, we don't have to be worried about this, or this. Black women need to be more concerned about this, and this. And then that's what we're going to do. I'm just going to get you cleared for all of these things, right? We're going to do this, and this. When he had to, do the examination and all, he was exceptionally careful, and he was like telling me all along what he was going to do, and, oh, this might be a little uncomfortable, and I really, really appreciated that. But I realized I'm appreciating him for doing what doctors are really supposed to do. And so many black women go to the doctor, and that's not the care we receive. So, and if Jessica Pettway was not, she's not the only example, as I said, that's been going on. Remember Serena Williams. Remember when Serena Williams was pregnant and she went in the hospital? First of all, she's had multiple times in the hospital, right? She shared with us. She had blood clots, right? And she was being dismissed. She's the most famous tennis player in the world. And they were still dismissive of her. Still. And then after she had her baby, she was having certain complications. And fortunately for her, she said she took matters into her own hands because she knew what kind of medication she needed. She knew she needed a blood thinner. She knew different things that she needed. And so she said, I got up out of my bed with my, the walker thing, right? And went and demanded it. Now, a woman who is she's hospitalized, she should not have to get up out of her bed to go and tell the medical establishment, no, I need this, not that. But even Serena Williams, right? So something is wrong in our medical establishment where we have to get up out of our own beds, where we have to assume the doctor doesn't see us. That means we have to be loud. That means we're in danger of being considered the angry black woman. What is she doing up out of her bed? Why is she not doing what the doctor said? Well, I can't trust that the doctor's doing what's best for me. I can't trust that the nurses even know or are paying attention, because we have too many examples of where black women's voices do not matter in regards to our own health. And this is nothing new. It's built into the system here. It's white supremacy within the medical practice, right? Go back and look at, you can Google this. You can go and look up the father of gynecology, the person who is considered to be the father of gynecology. His name was James Marion Sims. James Marion Sims from the 19th century. And he is famously called the father of gynecology, but he is also infamous because he experimented on enslaved black women without any anesthesia, because again, black people, whatever, less than human, 3/5 of a person. Black women don't experience pain the same way, right? So this is what we mean by the systemic nature of it. If there's a 19th century doctor operating on black women without anesthesia because he doesn't think that we experience pain, and this is still what's happening in 2024, yeah, it's layers. It's layered into the way medical education is done. It's layered into the way medical personnel think about me when I walk into an ER or a doctor's office. Just off top, they're looking at me. They don't know why I'm here, but they're making certain assumptions about me already. It's layered in. And that's why we talk about the intersectionality of being black and women. Because there are things that we deal with that white people don't deal with, and even black men don't deal with. So the intersectionality of being black and a woman means a certain set of circumstances that we have to deal with, right? So again, if you want to look him up, considered the father of gynecology, James Marion Sims. This is why we have to look out for ourselves. And also what you might look up, maybe you know this, and it's slightly humorous, the invention of the vibrator. The reason why we even have a vibrator is because in the 19th century, again, women's health care was so minimal, people so readily dismissed the health concerns of women, really white women we're talking about at this time. And women were just considered to be hysterical. That was a literal medical diagnosis to say that a woman is hysterical, right? And hysteria comes from the Greek word uterus, right? It comes from the word for uterus, which means that, oh, there's something wrong with her. We don't know what, but it has something to do with her uterus being out of place. And the way that her uterus gets right back in its place is for her to have relations with her husband. I'm not telling you, I'm not making it up. It might sound, go and look it up. Origins of the vibrator. hysterical women who were told that the way to handle your, illness, whatever was going on with you, go and have relations with your husband. Now, what if you don't have a husband? And in the 19th century, you are not allowed to be with anybody other than your husband. So then there was the invention of this tool. So you could go to the doctor's office, and the doctor would do it for you to the point where you have that special release, shall we say, here on YouTube, where you have that special release, and then women would feel kind of happy in the moment. But this meant that women kept coming back and coming back because their real medical needs were not being addressed. And that's the reason why we have the vibrator, because doctors said, I'm getting overloaded with requests for this vibrator, which was a huge machine with like an attachment, right? And over the years, it got smaller and smaller and smaller because doctors said, we want women to be able to do this at home and not come in here. It's too many of them all the time. Now, I said slightly humorous because, we think about, okay, what we know a vibrator is used for now, for pleasure and at will. But it was originally because the medical industry had so little knowledge about women's bodies and cared so little. It just was like, well, whatever is wrong with her. She's hysterical. Send her on home. So, again, I wanted to come on, this Women's History Month. This is always a topic for me to talk about women's issues, and specifically Black women's issues. I always want to highlight what is going on for us. As I said, I went and had some medical issues myself. Everything's cool. But, I did have to, just in transparency, I did have to have some stuff done. And, everything's cool. And I am so fortunate. I am so fortunate and grateful. Everything's cool. But it's also like you never know. You never know. So if you're watching this and you haven't had mammogram, you haven't been to the GYN in a while, please go. Whatever men are in your life, drag them to go have a prostate exam, right? Especially Black men, they don't want to go to the doctor. And that's a whole other topic. We can talk about why Black men don't want to go to the doctor. The same thing, the same kind of institutional racism. The same thing that, led to them being experimented on in the Tuskegee experiments, right? Untreated syphilis. And so it's important that we continue to know our history, because when you don't know your history, you can't connect to these things. And we live at a time now in America where there's so much pushback against DEI, diversity, equity, inclusion, so much pushback against talking about African American history or teaching African American history in schools. An absolute absurdity. But, okay, no, we don't want to talk about African American history. Well, when you don't talk about it, then people are cut off from the kind of knowledge that I've just talked to you about here today. And some people can remain in their racism because they don't understand what exactly systematic racism is. They've just been told it's not a thing, so they think it's not a thing. But no, when you can connect the historical dots, you can say, wow, I never knew this has been happening all along. Yeah, so believe Black women when we tell you this has been happening all along. And that is the systemic nature of it. Okay, so I'm going to wrap this up, and I would be thrilled if you would like, share, subscribe, share it with some other women. Comment below on maybe what you've experienced, such as you're willing to share. I do have a playlist here. I talked about having fibroids, and those are some old videos. So every now and then, though, some people are commenting on those videos because fibroids are so common among Black women. Another thing we could talk about. Almost every Black woman has fibroids. Almost every Black woman in America, anyway, that we are tracing in America. There's something not right about that. But again, topic for another discussion. I'm sure many of us could put in the comments that, oh yeah, I've had fibroids. Oh yeah, I have them now. Oh yeah. So I did a playlist of my experience with that some years ago. I did not have a hysterectomy. I did have a surgery, but not the hysterectomy. And I just had to deal with it, as many of us do. So anyway, like I said, share whatever you're comfortable with sharing in the comments. What else did I want to say? Yeah, I think that's all for now. Bye.